Hey, yummy. Ah.
Borderline personality disorder is that 1 to 2% of the population that first seeks out other people and then wants to be close to them. They want to be the best lover ever. They want to be the best friend ever. They're a wonderful student. They're an insightful therapy client. But then, in weeks, in months, they begin to feel betrayed, ripped off, misunderstood, abused by this other person, and they go into a rage that they cannot control. And then out of that rage, they want to get really close and they want to hurt that other person. And they feed off of that hurt, even though they don't know. It's secret sadism. And they feed and they feed and they feed, and the other person gets hurt, and they get scared, and they get pissed, and they try to get reasonable, and they try this, and they try that. Nothing works. And the borderline clings and tortures and feeds off of the suffering until finally the person says, I don't ever want to see anything to you again. Get out of my life. I'm going to get a court order. I'm going to get bodyguards. I'm going to get something happen. I'm going to get the wrath of God. Get out of my life. Never call me again. The borderline goes, again, I am abused. I am betrayed. Can't trust anybody. Now, if the borderline does not have another person to attack, they attack themselves. They self-mutilate. They do eating disorders. They binge and purge. Bulimia. They get anorexia. They do horrible things to their bodies. Now, you can have really high-functioning borderlines that are out there, politicians and movie stars and everybody, and they get close to people. And unlike narcissists who demean and withdraw, these borderlines find somebody they can't stand or somebody they can't stand, and they just want to hurt them. And hurt them and hurt them. Sometimes they want to hurt classes of people. As you can understand, therapists are scared shitless of borderlines, so they love to talk about them and rarely like to work with them. Why? Because it's really hard, and after about 2 or 3 months, you go from being the best therapist ever to being an asshole who's abusing them, and who can I write a letter to get you in trouble, and you're not suffering enough. Now, borderlines are not evil people. They're human beings who want to love, they want to live, they want to thrive. They actually love therapy, though they tend to do pretend therapy rather than real therapy. And I want to talk about deep analysis about when I was a little kid. That's pretend therapy. Borderline will come and go, I want to talk about how everybody abuses me and what assholes they are. Pretend therapy. Real therapy is, look, you have this paranoid vision of how the world is. That's not consistent with my vision. Let's examine our two visions together. You do that forever. It's very difficult, easy to talk about, hard to do. Now, you might be worrying that you have personality disorders. You might be worrying that somebody that you love might have a borderline personality disorder. Don't worry that much. 1 to 2% is not everybody, and you can tell the difference between borderline traits, which we all have a little bit. All of us get pissed off when somebody hurts us. We all like the revenge movie. All the guys do. We like it when someone who hurts us gets it in some fashion. That's true. But someone who's a normal neurotic like you and me, if you say, Keith, you just were an asshole about 10 minutes ago, you were mean, I'll feel guilty and I'll go, I'm sorry. I will see that meanness and I will become less mean. That's what normal people do. A borderline person, if you go, wow, you were really cruel to that person. And you know what happens with them? They go crazy. They start getting a weird look in their eye and they go, you're abusing me. You don't understand me at all. Borderline personality disorder has about the same unemployment rate and employment rate as schizophrenia. Yeah, it's that much of a crippling thing. I suspect 60% of the world's problems are caused by borderline personality disorder. I suspect that 80% of the big problems that therapists have with their clients, borderline personality disorder. This is the great unseen epidemic that's fucking everybody up. Let's do something about it. Let's change personality disorders into normal neurosis. Let's take normal neurosis and change it into being one with God. Priceless advice from Dr. Keith Witt, the therapist in the wild.